The President is calling today to reach out to us to say, be of good cheer, let us stay united in our common bond, which is to work on behalf of others, to work on behalf of health care, to work in the service of others, and not for personal profit and private gain and a political agenda that has nothing to do with servicing the people that we all feel we are involved with in a community way, in an Ohana way, in a family way, in an extension of ourselves and our goodwill and compassion and understanding for one another.
National health care reform has become a lightning rod of controversy.
And President Barack Obama is looking to overhaul the health insurance system and provide coverage for every single American. Leland Kim is live in front of the Queens Medical Center with both sides of this health care debate.
Chris and Steph, it is a huge issue. We are talking about 46 million Americans who don't have health insurance, and none of them end up in the places like the Queen ERs, which is not meant for primary care. Now, many people can agree that the problem has to be fixed. They just can't agree on how to do it.
Welcome to the Rumble.
Throughout the country, this has been the scene at various town hall meetings on health care reform. It's a heated debate on who gets health care and who pays for it.
Healthcare expenses are escalating, so people who can afford health insurance today, in the near future, may not be able to afford it.
President Barack Obama is making a push for nationalized health care. He's trying to rally support via nationwide teleconference calls like this one in Chinatown.
This debate over health care goes to the heart of who we are as a people. I believe that nobody in America should be denied basic health care because he or she lacks health insurance.
Representative Neil Abercrombie, who supports the president's plan, says the current system is too expensive.
We're going to try and cover everybody. Right now, those of us who do have insurance are paying a hidden tax in Hawaii of about 7%.
So, Congressman, I think you're still in favor of the public option. I guess the big question people have is how do we pay for that?
We're paying for it right now by not having it done. What happens is, in everybody's premium, right now in Hawaii there's about a $700 charge that goes in and added premiums to take care of the uninsured. So the payment has to come out of our premiums right now. What we're trying to do is spread the pool, just like we did in the early 70s in Hawaii, by broadening the number of people who can lower the cost by sharing it out.
How can you assure that cost will be kept down with this public option if you have a bunch of people pouring into
What we are assured of right now is insurance companies own your life. They can tell you, well, we'll diagnose you, but we won't treat you. You find yourself in a situation where an insurance company decides your fate. So the public option is very, very simple. It means that we will have true competition among insurance companies to see to it who can deliver the best service to the public. If the public option is not going to work, what's everybody afraid of? Let me just, some old friends and some new friends. The whole idea behind the President's conversation today with the country is to try to offset the kinds of things that are the result of the kind of corporate control of health care.
Lasted just about 10 minutes, but the message was clear. Don't believe opponents' lies about universal health care. Here are the fast facts. Democratic bills in the House and Senate would expand coverage to 46 million uninsured Americans. It includes a government-run insurance option, stops insurance companies from denying coverage based on pre-existing medical conditions, and partially pays for it with a tax on households making more than $350,000. KGMB9's Tim Sakahara has more details. Tim?
Tanya, the White House says President Obama would go to the moon if it would help him pass the health care reform plan. Now, while he has no plans to go that far, today he did pick up the phone with thousands of people from faith-based organizations.
And thank you all for participating in this call. Good afternoon, everybody.
If you're from the group called Faith Action for Community Equity, or FACE, but there were thousands more nationwide on the line.
I think it's exciting. I'm a little starstruck.
The president took the opportunity to dispel myths about his plan, especially about abortions.
You've heard that this is all going to mean government funding of abortion. Not true.
Inside of our organization, we've been talking about, what's going to happen around abortion, and I was really pleased to hear that he was absolutely solidly telling us that federal funds wouldn't be used for abortion, period.
Congressman Neil Abercrombie was also there to counter rumors, saying the plan would not create a death panel for the elderly or give insurance to illegal aliens.
Obviously, it's completely absurd. And everyone who is here today working with FACE has as their motivation not personal profit, not personal advantage, not taking advantage of others' dilemma, others' physical challenges, others' pain, others' difficulties, both for their families and for their pocketbooks in terms of being able to have the kind of health care that they need. That's what the president is talking about.